Hello everyone, hope you're doing well today. Today's show about what is health and literacy and how is it important. I've got a guest on my show, Yasmin Begum, who is a community researcher. Yasmin, welcome to the show.
Thank you very much, Hafsa. Thank you very much.
And how was your day today?
I've had a very productive day. Thank you very much.
That's good to know. So, Yasmin, if you can tell me something about Health and Literacy Project, what is it?
So, health literacy is the ability to understand and use information related to health. Mm-hmm. This means knowing how to find, read, and understand things like medical instructions and things like that. Especially when doctors tell you to do this or that in a specific way. Mm-hmm. It's being able to understand those instructions properly and to adhere to them.
Okay. And why is it important?
Health literacy is essential for making informed health choices. Right. If you understand what the diagnosis is and what the options you have a better chance of making the best decision. Right. As opposed to if you don't know what the doctor's saying and you don't know, you just say yes or no to something without knowing. Obviously, you're not making an informed decision. Right. So it's important to understand what the decision you're making. Mm-hmm.
I understand that it is important for somebody who cannot speak English properly. They don't know what kind of services are available, as well as the treatment they're going through, because a lot of the times they need to use interpreter or their family and friends and all that. But before we go into all these details, I would like to know, how did you come on about it? How did that project come on about? How did you notice that this kind of services are required within the community?
Okay, so I'm a member of Katie's team, and in Katie's team we have people from different disciplines. Mm-hmm. So we have doctors, we have nurses, we have expert by experience, we call them EBE. So we have everybody in that group where we discuss women's health. Mm-hmm. And this topic came up where women didn't understand much about their pregnancies. And
so this is more focused on the pregnant women?
Yes, okay. Because it's better to focus on one little part than to focus on so much and not get much done. So at Katie's team, we discussed this and we realized that something needs to be done. We need to help the women. Yeah.
Okay. And so if you can explain to me, what is Kate's team?
Yes. So
Katie's team.
Yes, Katie's team. So Katie's team was formed in 2015 by Women's Health Research Unit at the Queen Mary University in London. So the group is still hosting lots of other projects in East London, and actually they are now collaborating with Ellie Charity and other institutions to grow their reach in the UK and internationally as well.
Okay. And what does Katie's team do?
They support patient and public involvement in research. Mm-hmm. They bring people together to share their experiences, learn and get new ideas. Yeah. They also advise on aspects of women's health research. They co-create research that matters. It's not just research, it's research that actually matters to people. And they have actually contributed to over 40 research studies. Okay. So far, and still counting.
Oh, wow. You mentioned earlier about Ellie Charity.
Yes.
And what's this charity is all about?
So the Ellie Charity was established in 2020. Mm-hmm. And they specifically fund women's health projects. Right. And what they do is they help advance kind of safeguarding women's health education and things like that. And so Katie's team's project with the health literacy fell into their kind of criteria, and it aligned very nicely. So they decided they're going to fund us for this project.
So how long is that project?
The health literacy project, well, it started in 2020, and it's taken us 2 years to actually get everything together and finally create this course, which will be delivered next month, September.
Right. Before that, while we were waiting and we were discussing about this project, and you said they have run a focus group. So if you can tell me how many people attended, or how many women, what's the story behind it?
Yes.
It was quite interesting to know.
Yes. I made a few notes so that I don't make any mistakes when I quote these things. So we ran a focus group in 2022, where we had 20 participants from the community. So these were women who couldn't speak English. And some of them could, but little, and others, they were very good English speakers. But we wanted a mixed bag of experiences and feelings towards this challenge that women are facing. So we invited them for a focus group where we discussed many things. And that's when the lady said we would want a 6-week course.
Right.
So from that, it has partly been co-produced, this project, because most of the information has come from the community. So it's a community project.
So it was a social research taking place, and then that's where all the information been collected, and whatever the focus group wanted.
Yes, that's what
how
we're
it's been
delivering.
catered for.
Yes,
Sounds great.
It's a course. It's a research project, pilot project by the community for the community, and that's the beauty of this project, because it's literally come from the women, what they want, how they want it, what the course should include, and how it should be delivered to them. So even the times they would want this course to be, everything was decided by the women.
Right. How was the engagement of the women who cannot speak English properly, and some spoke little, some spoke better? Yeah. So how did this 3 group work out?
So when we had our first focus group, we had 20 women that came in, and we had translators.
Right.
And obviously I was there with the rest of my colleagues. And there are about 4 or 5 women that are involved who speak Bengali.
Okay.
And some can speak Sylheti and some can speak Bengali. So we had a mix of people.
Group. So purely these women are from Bangladesh background? Or
yes.
It was different ethnicity?
No. So these women are, yes, they're from Bangladesh who have they've got married to somebody from this country who's now brought them over.
Right.
And some have been here for 5 years, some 10, and some are really new.
Okay.
And so so some of these women have had babies before. Okay. But when we put the recruitment posters up, a lot of women wanted to join. And because obviously it affects a lot of people, and when we said that you can help create that difference, I think it kind of really highlighted the fact that, maybe I can contribute something. And we also gave a little incentive to say thank you for your time.
Okay.
So it was we gave a £50 cash payment to all the women that came to the focus group.
Oh, that's nice.
Yes, so when we had the focus group, obviously we had little tables. We ran this focus group at the Royal London Hospital, near one of the staff rooms. And so we had two facilitators on each table, and women were able to speak in the native language, share stories and their challenges, and obviously we were making notes.
And what were their challenges?
The challenges were that they did not understand everything that the doctor or the midwife was saying, and they could not express their challenges as well. what their issues, like
Right.
if someone had issues with very bad morning sickness, that condition is called hyperemesis gravidium. So they didn't know what that was called. So
Right.
they would just say, "Oh, I would vomit." But even the fact that they couldn't say, in Bengal, "Ammi bomi khorsi," But when they go to the midwife or doctor, they don't know how to even say that. So those were the challenges, to say simple things like, "I have back pain." They'll say, "Amar pite beta kore," but how do you say it in English to the doctor?
That's true.
So those were little things that were actually big challenges.
Absolutely. I mean, we do come across a lot of women or men who cannot speak English properly. They have that kind of challenges, and small things makes so much difference. And if they know how to express themselves, it does make them feel that, oh yes, I can get my point across to either to the doctor, solicitor, barrister, or whoever it is.
It's of mutual benefit for the doctor and the patient if they both know what they want to say and they understand what's being said to them.
Right. You did say that this project is focused on pregnant women, but why on pregnant women only? It could be any other group you could have chosen.
That's a very good question. And I have a beautiful answer to that. This project is vital because there's 2 lives involved in this, not just me, myself and I. There is another life. So it's 2 lives that matter here. So it's important to give this project and this kind of this time of a woman's life priority.
Absolutely. And what problems do non-English speaking pregnant women face with the health issues?
They can't express how they're feeling, and if they can't express how they're feeling, the doctors quite don't understand what's happening or can't diagnose what's happening. And that's really crucial in pregnancy because of the impact and the effects it has on the baby. So, for example, gestational diabetes, that can lead to so many complications, cesarean section, and then the diabetes. The mother can have diabetes later on in her life. After that, the baby can have diabetes, be born with diabetes, and things like that. So it's really important to understand each other so that we can diagnose and treat early. Absolutely. Rather than later, so we can we even prevent, actually, not only cure, we can even prevent some conditions.
Yeah. Like you're saying that it can affect their health decisions for pregnant women. So in order to make a decision on the situation they are going through, they find it hard because they don't understand it.
Yes, the first step in the right direction for any situation is acknowledging the situation and understanding it yourself before that's the first, whatever it is. The first thing is you find the problem and you understand it, and then only then can you explain it to somebody else and then get treatment or get a solution.
Sometimes, Yasmin, we don't understand, even though we can speak English or speak the language. Even like we've got our doctor there, and the doctor speaks Bengali or our native language. Still, we find it hard to express ourselves with the symptoms that we go through. So, wouldn't that kind of make a difference? That although I can speak English or Bengali or whatever, I cannot express myself. So, isn't that an individual thing?
That's definitely an individual thing, but that's also where the doctor comes in or the midwife comes in, to make sure to make patients feel comfortable in order to share their thoughts, issues, and help them express themselves to the professionals. Because if you don't know what your problem is, you can't talk about it and you can't get a solution to it, and things will just get worse. So I'll share a little example. This lady, so in the focus group, this lady was saying how she had gestational diabetes, but she didn't know what it was. And the midwife told her that your bloods came back and you've got gestational diabetes, but she didn't know what it was. So she carried on living her life as normal. She's a big eater, and she loved eating sweets and things, sugary, like mishti and things like that.
And there's a crave when you're pregnant.
Absolutely,
You've got a crave.
you're craving for all these things,
All
and
these things.
she did
Something you're not allowed to have. That's when you crave the most.
even more. Yes. So she was a very thin lady, and the story was shared by her sister-in-law.
Okay.
So she was saying, my bubby, she was very thin. Suddenly, she just became so big, and we were really concerned. And so we took her in. Her sister-in-law went with her to one of the appointments. And that's when the midwife said, what's happened to you? You know, we've told you that you have gestational diabetes. You need to control your Nova. And then that's when she realized that her sister-in-law had diabetes. But by then it was too late. And so she had to be booked in for an emergency C-section because the baby was too big and it couldn't be delivered normally. So those are the things that can happen if you don't know or if you don't understand what the doctor's saying to you.
Usually family member, either husband or somebody will go with them. If not, then they provide interpreter for somebody like her. So wasn't there any interpreter available? Anyone to explain to her the situation?
That's the thing with interpreters, they're not always available. I mean, some people are lucky and they can book interpreters in earlier, but some people aren't. And what happens to those that aren't? And then there are family interpreters. So some might take a niece or a nephew to the appointment with them, but there's a risk in that. There's a risk of confidentiality. And sometimes, like you might take your sister-in-law, your mother-in-law, or whoever, but then the mother-in-law, whoever's with you, they will know everything about you, and they might even encourage you to do something, make a choice that you're not really happy about, you know. So it's important if you know these conditions, if you learn about these conditions, you are more able to make the right decisions for yourself with how you feel.
That I understand, but at the same time, you know, sometimes there are alternative words, simple words can be used. Many women, they might not understand, or men may not understand gestational diabetes, but it could be, there will be other synonyms words that could be used to describe that word. So shouldn't they use something much more simpler words rather than like earlier on you were saying about... yeah, I mean, someone like me even, we're not used to that kind of jargons, using it unless you are in that kind of field working. So it's difficult for these people to understand. So shouldn't the doctor or the nurse or the midwife, shouldn't they be cultural sensitive, and shouldn't they be using simplified word basically?
See, this is a big challenge for doctors, because it's not just one ethnicity, one language. There are lots of ethnicities, and it's not fair to say to a doctor, you have to know all the languages so that you
don't need to know the languages. What I'm trying to say, much more simplified words that somebody will understand.
Yes.
So if I go and say to somebody, you've got hypertension, they'll think, what on earth hypertension is, because they're not used to the term. But if I go and say to them, you've got blood pressure problem, your blood pressure is high. Everybody knows what blood pressure is. So that's what I'm trying to explain.
That's a really valid point.
So wouldn't be doctors or nurses or midwives, they should get some cultural sensitive, or they should get to know about the community, the area based where they're serving. Then they should be. Their approach should be very, how can I put this in word? Very sort of...
universal?
Universal, so they don't have to use those kind of words.
I totally agree, but if you can learn about these words, there's no harm.
No, of course not. Of course
So
not.
there's like every day we're learning new things, we're learning new words, and if you learn, you can. It's a benefit,
Yeah.
isn't it?
That
so
I
yes,
agree.
absolutely. Using simpler terms is good, but if there are some people who are quite intrigued and they would want to know what is that condition actually called, you know. So I think there's benefit in that, where if you know the actual name of a condition, you can feel more confident when you talk about it.
That I totally agree. Again, I would say that I agree on that, but at the same time, say somebody who came from Bangladesh, they're pregnant and they don't know the services that literacy project is available. Right. In the meantime, the GP or the doctor or whoever seen this patient and they explained, they said hypertension, they said those kind of words, and they were not sure. Sometimes all the interpreter, because they're family interpreter, they don't even know some of the...
See, that's another challenge, because they're not professional interpreters or health interpreters.
Exactly.
So they wouldn't even know. So it's important that if you learn about these things...
But what I'm trying to say, before they can go and learn about it, so somebody came from Bangladesh already pregnant. At the earlier stage,
yes,
and they don't know. Their family went, and it's a challenge, and big challenge itself, because first of all they came to this country just recent.
Yes.
They need to get used to this country culture, everything else,
yes,
the weather, everything.
Yes, yes.
Top of that, language is a barrier.
Yes.
They don't understand anything at all, because absolutely. So because of that reason, shouldn't there be, and they don't know about the project that you guys are running. So shouldn't there be some information given? Shouldn't there be some support given to those kind of patients? Shouldn't they be, the health service should provide early stage before they can refer this patient to your services?
So this project that we're working on has been designed addressing those issues. So we can't tell the doctors, or that side is not our business at the moment. Okay. We are running this project because we can see it's needed, very much needed for people, and the women have told us that this is what they want. That's why. But how the hospitals are run or the antenatal clinics are run, that we don't have any kind of hand in that at the moment. Yeah. So we're working with what we can do, and this is something that we can do, is we can create this project and deliver it to women that want to learn about pregnancy.
Right. So those women, do they have to be pregnant to go to those classes, or it could be anybody?
So if you're thinking of becoming pregnant, it will be very beneficial for you. If you are pregnant, absolutely beneficial for you. And if you've already had a baby, you learn something new every day. I mean, I have 5 children and I'm still learning about pregnancy. I'm also a birthing companion. I've helped deliver many babies, and I'm still learning about,
changes.
Exactly.
And then things
and
changes,
there are so many new
everything.
apparatuses, tools that are coming in. And if you know about them, you can make more kind of informed decisions. Like, actually, I don't want the pethidine, I want the epidural.
Yeah. Or
I don't want the epidural, I want this, or Gasaner, or yeah. And what is Gasaner Entonox? If you know what your options are, you can make a better choice.
Of course, and that only can happen if they attend the antenatal clinics and things like that. I understand, you're not tapping into antenatal clinic and all that, but
we are. The recruitment will be from the antenatal clinics.
Right. That's what I was going to say. That, shouldn't you work in partnership with the antenatal clinic, because that's where you can recruit these newly mothers,
Yep. So pregnant mothers and So,
but don't you think the fathers should contribute as well? They should come to these things so they can understand more.
That's a fantastic point. that's a fantastic point, and we have thought about this. But initially, our scope is to address this for the women first. And if it goes well, we're hoping to get fathers involved. We're hoping to run it further afar and into different regions and make it national. Right. But first of all, we have to see how it goes. We did run a pilot project in Southend, and it went really well. But the participants in Southend were from multiple ethnicities. The project in Tower Hamlets is only for Bengali women, because if we took in so many ethnicities, it would be quite hard to cater for everybody. So we started off with the women that came to the focus group were Bengali. So we started with that, and we're going to work from that. Okay. If you know, it's only the beginning. So yeah.
If you can tell me duration of the course.
So the women decided they wanted this course to be 6 weeks. They wanted it to be for 2 hours because of their domestic commitments and things like that. They wanted it to run from 10 to 12. They wanted certification of completing this course. So basically everything they've asked for or they wanted has been integrated in this project. And it's, like I said, it's for the community, by the community. We're just people putting it all together, but they are the actual protagonists.
When are you planning to start?
So we've started the recruitment, and the recruitment posters have gone up at the Royal London antenatal clinic on the, I don't know if it's the 9th floor or the 11th floor. Okay. I'm not quite sure, because we have our obstetrician, Dr. Mandeep, who's dealing with that, and so we'll be recruiting. So we have two members of staff for Fazana and Ruxana. They'll be sitting in the antenatal area, and they will be recruiting. And obviously, it's not as simple. Recruitment isn't as simple as, do you want to come to the course? Oh, let's come. No, there's consent. There's so much to it. So you really need to sit down with someone before you can enroll them onto the course.
Also, you have to bear in your mind that recruiting somebody from Bangladeshi original, you need to speak to their family as well, because family plays a key part to make this decision making.
Yes. Yeah. And usually these women have somebody with them at the antenatal clinic, so they can kind of decide. And it's not like, you have to sign up today. No, we give the information, you go home, read about it, or even ask your family, talk to them about it, and then you can phone or you can use the QR code, or we give our numbers. We have a work number where you can contact and say, okay, I want to sign up. What do I do? What's the information? You know.
Yasmin, I wanted to talk to you more about this, but time is up. So before we leave, if you want to say something for the audience, and then...
I actually had so much to say to the audience with regards to this course. But as we're out of time, I'll just say that if you have anyone that is potentially, that suits this course, which is the Health Literacy Pregnancy course, please do sign up for it. You'll see the posters at the Royal London at the antenatal clinic, and somebody will get back to you definitely.
Thank you, Yasmin, for coming, and viewers and listeners, thank you for being part of LB24 ChitChat show, and I'll be here with some other person next time on my show. Thank you.